state for the court your full name?
Sharon Jade Pickles.
Ms. Pickles, how are you feeling today?
I'm exhausted.
And why are you so exhausted?
Well, ever since my stroke, I just find it harder to do everyday activities and it just drains me a lot more.
Okay, tell the court what you find harder.
Just the simple things like getting up in the morning and getting dressed and just doing my chores around the house.
Okay, and I believe that you have 2 children as well?
Yes, I do. They're 4 and 6 years old.
Okay, so you're no longer working?
No, I used to be a professional violinist and I can't do that anymore because of my stroke. So I'm not independent anymore and I'm finding it very hard to support my children.
Oh, okay, so the father of the children, is he helping you at all?
No, he's not on the scene anymore. We got a divorce about 2 years ago.
Okay, alright. Alright. Ms. Pickles, when did this change occur?
After I had my stroke.
Okay, and when did you have your stroke?
On the 10th of February.
And was this not the same day you received treatment from Mr. Trivette?
Yes.
Okay, so do you believe that Mr. Trivette caused your stroke?
Objection, Your Honour.
Your Honour, question withdrawn. Okay. I'd like to put before the court this article by the Australian Physiotherapy Society titled Clinical Guidelines for Assessing Vertebro-Basilar Insufficiency in the Management of Cervical Spine Disorder. Ms. Pickles, have you ever seen this form before?
No, I haven't.
You haven't. The form I put before Ms. Pickles is the record of informed consent. So Ms. Pickles, does that mean that you did not sign any form of consent for your treatment?
No, I didn't sign anything.
You didn't, okay. Members of the jury, in this APA guideline, it outlines 5 areas that a physio must discuss with the patient in order to give informed consent. Mr. Trivette needed to educate Ms. Pickles about the procedure he was going to do and the risks involved. Ms. Pickles, did Mr. Trivette inform you about the proposed procedure?
He just said that he was going to crack my neck and that it would decrease my pain and loosen up my neck a bit more.
Okay, and did it decrease your pain?
No.
No, it didn't. Ms. Pickles, did Mr. Trivette give you any alternative treatments that he could do to help your problem if he weren't to manipulate your spine?
No.
No, he didn't. Ms. Pickles, did Mr. Trivette outline the benefits and risks of manipulating your spine?
Yes.
Yes, he did. Okay. And did he give you the opportunity to ask questions about what he told you?
Yes, but it was quite brief.
Okay.
I wish I'd asked more.
Yes, yeah. Did he give you the opportunity to have adequate time to think about what he'd explained to you before you made your decision?
Not as much as I wish I had.
Okay. Ladies and gentlemen of the jury, Mr. Trivette documented all of this information in his notes on the day. However, he failed to consider these risk factors in his clinical reasoning. These are all documented risk factors on vertebral artery dissection. However, Mr. Trivette overlooked these. Was it because he was not up to date on current research, or was it because he ignored these factors, putting at risk our patient and breaching his duty of care to our client? Your Honour, I would like to put forward this article by Haldeman as evidence of the risk factors for vertebral artery dissection.